can test for them. So you need to get the omega-3s in. I always tell folks that you need to get it in or need to get it in, right? So you either need to get it in good quality fish, or you need to take a good quality fish oil supplement, one or the other. And you always can tell whether you have too much because you can test for it, because not to test is to guess, test is to know. The other part of an anti-inflammatory diet is the omega-6s. You can take omega-3s, but you cannot take an omega-3 to get rid of an omega-6. Does that make sense? You can't just take an omega-3 to get rid of eating popcorn every night that's been soaked in corn oil. Okay, you just can't do that. So trying to decrease your omega-6s, and that's why when we make our dietary recommendations, normally we do food testing too, and so we'll normally test, and a lot of times people have some sensitivity to either gluten, maybe soy, something like that, and we're using that as also a catapult to recommend people to actually eliminate one of these omega-6 foods. And of course, eliminating your processed foods. If you go look right now, even if you have cough drops in your house, you will find an omega-6 oil in there. It is everywhere, and nobody's getting in the omega-3s. And so then what's happening in the case of autoimmunity, in the case of arthritis, in the case of cancer, in the case of all these things, we have this whole inflammatory cascade is turned on. If we can decrease the omega-6s, increase the omega-3s, that's going to be a benefit. That's going to be a huge benefit.